Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with bilateral fully occluding earwax. And I'm just commencing with their right ear first. And as soon as I entered with the microsuction tip, I just felt that this wax required a bit of medical grade olive oil spray to help change the consistency, to coagulate it so it suctions better. So the wax is quite mushy. And to the right, that piece of flesh there, that's the second bend. And I'll try and show you where the first bend is. So our ear canals are sigmoid shaped, they are S-bend. The first bend in the ear canal is about 0.5 centimetre in, and that's followed by the second bend, which again you can see to the right, which is a further 0.5 centimetre in. And that wax centrally where the suction probe is there is probably 2/3 of the way in, but because of the magnification offered by the WAXscope, it obviously looks quite close by. And what I want to do is separate this from the canal wall. Just to the left, where you can see that flesh and a few hairs protruding, that's the first bend. So it gives you an idea of the architecture of the ear. Now with the WAXscope, because you stretch the ear open with the specular, it somewhat straightens the ear canal. When you enter with an endoscope without retracting the ear, you'll get a full appreciation of the anatomy. In fact, when I first started using an endoscope, I saw the ear completely differently. So when I was training as an audiologist at university and also within hospitals, as part of my university training and post-modification, we just use otoscopes. So otoscopes are your more basic ear torch and visualization method, if you like. And you don't really get a full appreciation of the anatomy and some of the pathologies. It's only when I started using the endoscope, probably 10 years ago now, so it's almost been a decade, that it really opened up a whole new way of visualizing the ear and approaching the ear. And it also, no end, improved my diagnostic skills and my anatomy knowledge as well. So I was very grateful for the use of the endoscope. Now, the WAXscope is slightly different. It's designed for specialists who struggle to use the endoscope. Now, not only that, the WAXscope does sometimes for me triumph over the endoscope, particularly for children. The speculum helps to keep the ear a bit more stable. So when you treat children, it can be quite difficult to keep them still. And also, if I'm working very closely to the eardrum, the WAXscope is really, really good because of the magnification. But the WAXscope is more like a 2D operating ENT microscope, whereas the endoscope is just a field of view is completely different. Now I'm going to stretch open the ear. I'm navigating that speculum past the second bend on the right. That helps to widen the ear, just getting the eardrum in focus. You can actually see all the texture, all the fibrous tissue in the middle layer of the eardrum with the WAXscope. So it really gives you a high definition view. And we're just moving now to the left side. So again, it's quite mushy, but it's a bit denser. You can see the colour is a bit darker. And I'm just leveraging the suction probe at the end, at the bottom of the floor of the ear canal. I'm trying to lift this up and away to separate it, which I did manage to do. But I think I'm just going to use some olive oil because it's quite dense. And there is a few adhesions to the right-hand side. I'm just giving it a little wriggle. And you can see the tail end of that wax plug deeper in the ear. So it's just a bit sticky and mushy in that region. So I just put almost half a square of olive oil. I didn't put too much in actually, just to soften the lateral surface so I can get a better grip. Giving this a little wriggle and tease, navigating around the bends. And as I am, I'm coming away with the specular. And that's the second, so that's the first bend to the right. And I'm just coming upwards as well, just in line with the orientation of the ear canal. So I have got a still image of the wax I move from both sides, so just the tail end separated. So I'm just going to mop this up. And then we're going to view the eardrum. So again, I'm just trying to get that specular on the left-hand side past the second bend. I'm lifting the ear canal up so we can see the whole eardrum, which we can see now. I'm just getting it in focus. That's the hammer bone right in front of you. Well, I'm just going to mop some of this up. That's the second bend there to the left. And that's the wax plugs removed from both ears. Well, I hope you enjoyed that video, guys. And if you're interested in the WAXscope, please do email info@clearwax.co.uk. Thank you, bye.